As we follow these patients, it affects us, right? It affects me personally. I found out yesterday that one of my patients, whom I thought I'd cured 8 years ago and came back now, a young lady with cancer in her lungs. And this really perturbs me. I want to do something. A friend of mine one day called me and had a mass and redness in her breast. It turned out she had a cancer. We treated her for chemotherapy. At first it responded, but then it didn't anymore. We found some changes and we were thinking maybe there might be a therapy that might work on this, but unfortunately she died too quickly. She died so quickly. Women with breast cancer, at some point are treated with surgery, which is what I do, but if the cancer comes back, they're treated with drugs, chemotherapy, other drugs, what's called biologic therapies and so on. But breast cancer doesn't kill because of what happens in the breast. It kills because of spreading to other organs. That's when it's dangerous, when it spreads. And unfortunately, once cancers have spread, they're very difficult to get rid of. They can shrink for a while, but then they have a tendency to come back, and that we call resistance. And what I want to do is understand why, so I could eventually overcome that resistance. So that's what I study. I study the causes of this drug resistance. Specifically, I look at these cancers, I examine them, I look for the molecular changes, the DNA that is different, the proteins that are different in these cancers, and try to understand whether they're responsible for this drug resistance. What really interests me more and more right now is also looking at breast cancer in younger women. In fact, breast cancer in young women is somewhat more aggressive than it is in older women. These women have families, young families, and the impact there is even greater. It is in fact the link with my patients which urges me more and more to do something more and more urgently for them as I see some of them die, some of them sometimes very young.